We're all aware of the many benefits of point-of-care ultrasound. For example, that it expedites care in some cases. And it provides more information for clinicians about their patients, as well as they get immediate feedback. It also, in some cases, improves patient outcomes, as well as patient safety. One of the important benefits that I think about with point-of-care ultrasound is parent satisfaction. When I'm working on a shift, if I'm doing an educational ultrasound or I'm doing a clinical ultrasound, I have many parents that say to me that they really liked that we were in the room and that they really learned a lot from the ultrasound that we did. Also that they felt that their child was getting better care because they were seeing the doctor more than they would if they didn't have the ultrasounds. Unfortunately, there's not a lot of literature out there about parent satisfaction with point-of-care ultrasound, but there is literature out there about patient satisfaction in adult patients in the emergency department. So in January of 2014, Zoe Howard, Vicki Noble, and several others published an article in the Journal of Emergency Medicine on patient satisfaction in for patients that came to the emergency department and had a bedside ultrasound. So what they did is they took a convenient sample of adult patients in the emergency department who had a bedside ultrasound. And as the control group, they had another set of adult patients who did not get an ultrasound, but had similar length of stays and presenting complaints. And what they did is they gave these patients a survey during their emergency department visit and did one follow-up phone call about 1 week after their visit. So they enrolled about 70 patients over 10 months. And what they found was that the patients that did get the bedside ultrasound, that they had significantly better, they felt that they had significantly better satisfaction with their overall emergency department care, with the diagnostic testing, as well as their perceptions of their emergency physicians. And they found this both while they were in the emergency department and 1 week later. So I think this is a great example about how point-of-care ultrasound really can improve satisfaction just for our patients, but as well I think it does for our parents. And I think it's an area that we really should research more because it is one of the great benefits of point-of-care ultrasounds.